Vanakkam. Good evening, everybody. I thank my sincere thanks to the organizers for inviting me here. As Charles Darwin said, it is not the strongest of the species that survives, not the most intelligent that survives. It is the one that is most capable to change. She married and had 13 children, then her husband died. She married again, had 7 more children, again her husband died. She remarried third time and had 5 more children. After a long life, she finally died after having 25 children. Standing before her coffin, the priest prayed for her. He thanked the Lord for this very loving woman and said, Lord, they are finally together. One monarch leaned over and quietly asked her friend, do you think he means her first, second, or third husband? The friend replied, I think he means her legs. This is the power of natural reproduction, and we are in the age of crossing off. The confusion began the fertility and infertility and sexual health because our patient mindset is changed. So, Mrs. Hyde and Mr. Seek, we are getting patients like this, and Mr. Busy, he can't ejaculate, and we have Mr. Mistaken, who takes his doctor's advice very seriously, and we have Mr. Worry. I think you can read that. It's very related to sexual health. And we have the McDonald's theory of evolution. As we know that when the patient comes to us at the age of 35, we have the fertility rate goes down and the chromosomal abnormalities goes high. And today's generation biggest worry is network connection, download speed, and the battery life. Today's life again replaces members with numbers. This is the big challenge for embryologists like us who deals with the assisted reproductive technology. As an embryologist, we have always this problem because egg alone and the sperm alone, they are surprising. When they come together, it is surprisingly complicated. For an embryologist, this is embryology. For the patients, this is embryology. But for the rest of the world, this is embryology. You can imagine our situation. So when we set up anything scientifically, any lab or any facility that we have to see three things. One is scientific, next is ability, then the reality. What is ideal is scientific, what is feasible is ability, what is viable is the reality. I am talking about the IUI lab now. So any setup, even you take IVF or IVF or IUI, we need four things are very, very important: the personnel, components, equipment, and the infrastructure. This we call golden triangle. So before starting this facility, you have to think, there are questions you have to ask, like what type of service are you thinking? Which is your target population? When do you want to start and expand? Who are your teammates? That is very, very important. Why do you want to start an ART facility? And how much can you invest? This is very, very important. And of course, the planning is very, very important because this is infrastructure. The building is very, very important because you can't alter the building, but you can add the instruments or the personals. Other two are changeable. This is very, very difficult to interchange. So as you know, till 2020, we don't have any regulation in India for ART. ICMR was trying the past 10 years. Then Health Ministry take over. We got the announcement in 2020 and 21. 21st surrogacy law came, then 21 we got the ART law. So now in India ART is well regulated. They have different classifications like level 1. You can do till IUI. You can't do not even stimulation. Then you have to refer to the level 2 clinic. Level 2 clinic you can do IUI, IVF, surrogacy and all other advanced techniques. And everything licensing is very, very important. Level 1, level 2, surrogacy, then ART biobank. This is very, very important because now it is well regulated in India. So when you come to the ART 1 level, this would be ART clinic where preliminary investigations carried out, including diagnosis type or cause of infertility. Only IUI is carried out as part of treatment, maybe like IUI semen analysis, and you can store the samples of the patients. Like suppose if they are coming for the husband is going out of station, you can store, but you can't store the donor's bones. Every time you want to get it from the ART bank. Level 2 clinic, I don't want to talk here, but it is level 2, it's for other advanced processes. And it is well defined now. You can't say that, keep on room, I'm doing everything here. No, it is not accepted. Because first time they will come and inspect and they will give you the license with intimation. After that, once you are given license, anytime they can come and check for anything from the state board. So there is a well-defined reception area, waiting room, consultation room, storage space and record space, examination room with privacy, backup power supply, fire safety arrangements. And you have, for general diagnosis, either you can have your in-house laboratory as per the law, or you can have a referral system where you can keep a collection center. You can tie up with any diagnostics chains, you can do that. And IUI room, what IUI room? There must be a separate area room with the appropriate table for IUI, suitable scan machine with probes. Privacy must be maintained. All instruments required for the procedure must be sterilized and available for use. Appropriate light source, of course, all the accessory things should be there. And you should have a semen collection room. It should be well-appointed room with privacy and an appropriate environment. It should be located in the selected area close to the laboratory. Must be available in-house. For various reasons, we are not encouraging patients to collect from outside. If the patient is getting sample from outside, you should have a separate consent or include a line in the consent saying that the sample is collected from outside. We don't know whether he is bringing his own sample or not, because we have lots of case histories, litigations, legal issues. So this is very, very important. Now the government is very much worried about the consent. As a clinicians, you know better than me the importance of consent. So procedure for collection semen as described by the analysis will be done by the WHO criteria. And we have the semen processing laboratory where the basic instrument should be there. There are list of instruments given by the guidelines, that is minimum. And if you want to add, you can add anything ahead of that. Usually we use the macula chamber and cell counter, refrigerator to keep your media or something like that. And test tube warmer, these are all the basic things. We have two things. One is non-sterile area, sterile area. All the semen processing, everything should be done in the sterile area. Semen analysis you can do non-sterile area, but we keep it in a sterile area. And of course, you should have a very good microscope. The processing, you should use a proper centrifuge and should have a laminar airflow. These are all the basic instruments. This is must. Without this, you can't get the license. And of course, you have the consumables where you have the semen collection container, pipettes, IV catheters, centrifuge, glass slides, cover slips, whatever day-to-day activities, you can use that. And you should maintain a logbook, QC and QM for all the instruments what you are using. You should have an AMC for that. And this is very, very important because these are all the parameters can be checked. And of course, whatever we are trying to get cheap, it is cheap. You won't get better things in a cheaper rate. So, and it is a one-time investment and it's a basic setup. So, this is the basic for the IUI setup. Infrastructure and instruments present in the laboratory is one of the most important factors in designing the quality of work done by the IUI lab. The maintenance of the lab provides us the longevity of the instruments complied to work, or will provide the basic of what should be present for the level 1 clinic registration approval. And further additions and subtractions is depending on the level of work of the individual level 1 centers. Thank you very much.